This is the setup of our vasectomy tray. So now I'm going to go one at a time and drop things on this tray in a sterile fashion, the things that we're going to be using that are extra. So the first thing I'm going to drop on here is a funny looking long Ziploc bag and a cautery tip. Second thing I'm dropping on here is a needle, a 25 gauge short needle that we'll use to deliver the local anesthetic. Here's my blunt needle that I'll use to draw up my local anesthetic. And of course, we're going to do all that, we need a syringe. I like the 10cc syringe. Next thing you're going to see flop on there is a set of staples. Titanium clips that we use to close the sheath over the proximal vase. And lastly, I love to have fenestrated drapes. A nice paper drape with a hole in it that's just perfect size for the scrotum. The next thing I'm going to stick on there is a bit of providine. Some of you will think, providine, that's so old tech. Yes, it is, but the new chlorhexidine isn't nearly as slippery, and I like to have slippery fingers when I'm filling the vase. The next thing I would do is sort out my stuff on the tray after I've loaded up my local anesthetic. 1% xylocaine that I'll be using for anesthetic, and we have our 8.4% bicarb. I use the bicarb with the xylocaine to buffer the xylocaine. The way bicarb works, in order to buffer 1% xylocaine, you need 1 mil for every 9 mils of xylocaine. So I'm going to take 2.2 mils out of this bicarb bottle. That is 2.2 mils of bicarb. There we go. And I'm going to add that to my 1% xylocaine. There she goes. Now I have buffered xylocaine. So, remember this fancy Ziploc bag? Well, now I put on my sterile gloves because I'm just about to rearrange my tray. But before I do that, I got to get this thing into the sterile bag. That is my cautery tool. So what I do is I open the sterile Ziploc bag here. I slowly have it grab the tip of the cautery handle, and then I let it slide in there. Once I've got it in there, I normally have it pushed off to the side so that the button is close enough to reach. And then I will take this device, well, it's actually the cautery tip, insert it into these holes in the end. And then we have the tip which I pinch to make nice and sharp. So we have the cautery tip onto the cautery handle, and I always check to make sure that it heats up properly. So now we're back to the tray. Here's my cautery handle. And before I do anything else, you'll notice that I have a bunch of green drapes here. I like to have 3 green drapes, and this one that they keep underneath the tray, I shift over so that I can use it as a normal sterile drape. Now I have my drapes that I'll put aside for the instant because we're going to clean this up a little bit. The first thing I normally do is get rid of this, which indicates that the tray is sterile. I move my gauze over to this corner, my providine over to that corner, and then I'm going to load up my syringe with buffered lidocaine. So we're back at my buffered xylocaine bottle. I'm sterile now, so I want to be sure not to touch. That's what's so practical about this apparatus. I don't have to touch anything. I just draw up my full 10 cc's. So here we are back at the tray. Here's where I take my blunt needle off and put my 25 gauge short needle on. And you'll notice that I don't like these things in the way when I use them for vasectomy, so I get rid of them. So we're all set. I often loosen up this cap because I'm sometimes taking it off with one hand, and I want to make sure it's not too tight. Now I'm going to sort out my tray so that everything is in the order that I use it. Starting with the special Lee brand no scalpel vasectomy ring forceps. This is one of the special tools that is specific to no scalpel vasectomy. The second tool is the Lee brand sharp dissecting forceps. So you have those two that are set out first. The third thing I put in there is my little safety clip. It's a little mosquito that I use to hold my vase in place once I have it out. The next thing I'm going to use is a single tooth forceps. I really like the fine ones. Sometimes they put thick ones on my tray and I tell them, don't do that. I want the fine, thin single tooth forceps. Next come the scissors, and finally the clip applier. So that looks like it's in pretty good order. The next thing I do to get ready is put all these drapes back over top. Because normally what I do is I set up the trays in the morning before the patient arrives. And so I want this whole thing covered up while we're waiting for him to get here. And so I have my cautery and my anesthetic in the order that I'm going to use them. And then I fold everything back up. So we're back to where we were, only now the tray is all set up and ready to go for when the patient arrives. So as part of the vasectomy setup, there's a couple of other things you have to set up besides the sterile tray. One of them is these requisitions. So these are the post-vasectomy semen sample requisitions. I'm going to give each patient 2 containers in a bag like this, and each of them will have a requisition in it. And these are for after the vasectomy so that they can collect a sample about 3 months later. On the requisition I have the date of the procedure and instruction about how to collect their sampling afterwards. I also have my mobile number so that they can call me with any questions that they have. So each patient will receive 2 of these packages. One for the sampling that they'll do 3 months after the procedure, and a second one in case that sample is not 0. So they can try again a couple of months after that. Let's move over here and I'll show you the other stuff that I set up and have ready. I have a couple of non-sterile gloves to start the procedure. I'll put those on and I'll tie the patient's penis up with this elastic band that I kind of loop around like that. So that'll become a little loop that'll fit around the patient's penis so that I can tie it up to his shirt using this little clip. Once his penis is tied up, I'll need 3 sterile, there we go, 4x4 gauze. So some 4x4 gauze that'll allow me to clean up the patient's scrotum. And I use Providine for that. Perhaps I'll add in one last thing. Normally I take one of the patient's labels and I add it to an appointment card. What I do that for is I stick a couple of patient details on the card and I put that in my pocket. That reminds me when I go home that I'm going to be calling this guy, calling him 2 days from the procedure to find out how he's doing. And that's the last thing I do.